Welcome to What's the Facts? My name is Roni Moya. Today I'm going to talk about joint stiffness and pain. What's the issue here? While you are aging, you will start to produce the senescence-associated secretory phenotypes. Those aging molecules will trigger the apoptosis processes, which are cell death chain reaction. Those apoptosis will disrupt completely the chondrocytes production, so the new cartilage won't be produced and old cells will be going to die. The replacement will be made by calcium deposits, which will lead to stiffness. You will have also during this process the production of the MMP, matrix degrading enzymes. Those enzymes will destroy completely the cartilage membrane. And without the cartilage membrane, again, calcium replacement. This process will be enhanced by the oxidative stress releasing. So all those oxidative molecules will lead to the catabolism via induction of cell death. Another thing that is very important, the oxidative stress and apoptosis will come from an aberrant activity of the mitochondria. The mitochondria, which will normally produce oxygen and energy, won't do it anymore and will trigger cell death. So mitochondria will be getting aging, they will be starting to be destructed completely, and the chondrocyte cannot be produced without new mitochondria. These processes will also be enhanced from the cytokines releasing. Cytokines will be triggered from inflammation. Inflammation will come from the 2-like receptor 2, 4, 7, and 8 membrane stimulation. Those chain reaction, which will lead to the activation of the nuclear factor kappa beta, the most known molecules of inflammation, will form prostaglandin 2. The prostaglandin 2 will start a chronic inflammation and impeding the production of new tissues. So you will have here the catabolic responses in chondrocytes. Chondrocytes will be destroyed completely, new cells cannot be produced anymore, calcium will replace the cartilage, and therefore you have those outcomes which are catabolism, destruction, more than anabolism. ATP death, mitochondria will not form oxygen and energy anymore, will form apoptosis. Therefore, inflammation and therefore pain. Of course, from inflammation you have pain. And stiffness from the replacement of the good cartilage for calcium. So, you have here the article. Exactly what I explained to you, the immune cells, the invasion, the activation of the 2-like receptors, the chondrocytes apoptosis, the diminishing of the oxygen from the ATP and from mitochondria, metalloproteinases, membrane destruction, osteoblasts cannot be formed anymore, osteoclasts will be formed, hormonal protection will be diminished from the aging processes. So in association here, you will have chronic inflammation, acute inflammation, stiffness, pain, and everything can be worsening from the comorbidities. Comorbidities are all those diseases that can trigger inflammation too. For example, Alzheimer's, stroke, myocardial infarction, cell senescence with the inflammation processes, hyperglycemia, hypertriglyceridemia, oxidation of the cholesterol. Everything can be connected to the cartilage and joint inflammation. So if you are sedentary, if you are obese, if you have all those comorbidities, you will have no tolerance, you have propension for autoimmunity or for other kind of inflammation in the joints. So you have here a lot of other groups that can be enhancing more and more inflammation in the joints. For example, trauma, local inflammation, low-grade inflammation from infection, for example, or from comorbidities, diabetes, starting slowly, low-grade inflammation. Also, food intolerance, metal toxicity, everything can be a low-grade inflammation, start as a low-grade and finish in a chronic inflammation. Aging, and also other kind of problems, for example, crystallization of the cartilage from uric acid enhancement. Every metabolic disease, every autoimmunity will lead to joint problems. So you have here the fact. What's the fact, people? Today, the treatment is much of the same. Hyaluronic acid locally applied. What hyaluronic acid does? Okay, we will lubricate a little bit more the cartilage, but will not produce a new cartilage. Biological treatment, for example, rituximab, it's an immunosuppressant, will destroy completely the immunity. Methotrexate, okay, another immunosuppressant. Surgery, after the surgery, arthroplasty, for example, the calcification will be faster coming. Okay, so you will have more stiffness after surgery. Anti-inflammatory, corticoids, and opioids, they will just intoxify your body and will diminish the symptoms, but will not produce new cartilage anymore. So you have to have a balance. What's the news? What is the new regenerative biological thinking? So, first of all, you have to understand that there is a peptide called IL-1 receptor antagonist. This peptide, which is a very small molecule, is the star of the regenerative treatment because it will genetically modulate inflammation. For example, it will inhibit the exacerbation of nuclear factor kappa beta production. Therefore, the inflammation, the cytokines, the prostaglandins will be diminished. It will be stimulating the Tregs, the T cells regulatory molecules, which will, by tolerance, diminish the exacerbation of inflammation, and also will overcome the regulation on the central nervous system. You know that the pain comes from the brain too, the glial cells. So the inhibitory inflammation from the peptides in the brain will be at the glial level, and also impeach the beta amyloid protein to be the starting point of the inflammatory processes in the brain. It will also prevent Alzheimer's. Remember, it's connected with the beta amyloid protein. So the IL-1R antagonist is a very important peptide. It's a very small molecule, and the new fact is that this is the boss of the regenerative and anti-inflammatory processes. So here you have the good effects from the 1LR antagonist, which is the osteogenesis, production of new cells, cartilage protection, bone ligament healing and faster, increasement of cartilage genes, reduction of the ratio from Tregs and Th17 cells, which is the tolerance from different kinds of T cells, and osteogenic differentiation. So you have new cells, better cells, young cells, less inflammation, a lot of things going on that is just protecting your cartilage and also producing new good cells. Protect and make your cells younger. Also, you can associate these peptides, IL-1R antagonist, with the phytotherapeutics. For example, curcumin, harpagoside, salicin, zingiber, boswellic. Those are phytotherapeutics that are scientifically proved that can diminish inflammation, for example, in reduction of the nuclear factor kappa beta, cyclooxygenase, metalloproteinases, or oxynitric, for example, or IL-6. Those phytotherapeutics can block inflammation through those molecules and also enhance other good molecules, for example, the brain-derived neurotrophic factor and hemooxygenase molecules. Those molecules will heal the ligaments and the joints faster, and they will enhance the neuroplasticity and osteoplasticity, production and adaptation of new cells from stress. Those phytotherapeutics can be associated with the IL-1R antagonist in the order of making a very good regenerative biological treatment without any side effects in every age. There is no limit here. How to think? So you can have a biological regenerative treatment in this idea, which is for example, associate the IL-R peptides with other mitopeptides, for example, cartilage mitopeptides. What are the mitopeptides? Those are mitochondria peptides coming from the tissues, for example, cartilage, bone, synovia, placenta, mesenchyme. Those have all the growth factor and regenerative factors that you can find in the original tissues. So those mitochondrial peptides will activate oxygen, energy, and new growth of good tissues without any side effects. That can be associated also with the ozone therapy and platelet-enriched plasma treatments. The growth factors from the PRP in the same injection of the peptides, for example, and the mitopeptides is amazing to trigger new cartilage. Also, orally, you can take those peptides. So you can, for example, make ozone therapy, which is the best immunomodulator ever, alternating with the PRP injection. Put in the injection the peptides and also giving the people the peptides orally if you want. This is what we have to do, associating those phytotherapeutics with the IL-1R receptor orally and through injection, associating with the other mitopeptides. So folks, that's the idea. Biological regenerative medicine without any side effects. My name is Roni Moya from International University of Bio-Regenerative Sciences. I hope you liked this video. See you soon. Bye bye. Keep young.